Nanoplastic surgery focuses solely on facial cosmetic surgery. So we consider ourselves experts in rhinoplasty and also in surgery of facial rejuvenation. From the time you call in and have a detailed phone call and really understand what you're going to experience from a consultation, all the way through the surgery itself.
My big birthday is coming up in March. I'm going to be 40. So I'm wanting to improve my neck. I've worked in surgery for 15 years, and I've had the luxury to kind of see who does good work and who does okay work. And Dr. Nayak would be my first choice, even if I didn't work here.
When Joanie first asked me to work on her neck, she, like many others, asked for liposuction. And I told her it's not the right procedure for her.
Lipo, I thought that would be like my quick fix of like, how do I get rid of this? I was thinking liposuction.
The main difference between liposuction and rebuilding the shape of the neck is that liposuction just sucks out the layer of fat between the skin and the muscle. That layer is actually important. It creates the softness and the prettiness and the support of the skin. Neck lifts don't really transform the person, but they do bring out the best version of that person, both on front view, and we can really see a clean jawline. In Joanie's case, we're going to take her buccal fat out, so we'll see a more heart-shaped face rather than a rectangular. And then on side view, we'll see that arc under the chin and a prettier contour in general.
I've had a lot of people ask me, you know, why am I doing this? You're so young, or you don't need it. It's not an age-limiting procedure. It's just about improving your neckline, which a lot of people can improve on, and they don't have to be in their late 40s, in their 50s. It's a surgery that anyone can have.
The worst thing about working on Joanie tomorrow is she's not going to be there to pass me the instruments. She's not going to be there to pass me the equipment because she reads my mind. So we're going to have to get along without her tomorrow.
The only anxiety I have was being filmed on KSDK, because the surgery itself, I know it forwards and backwards, and if I could probably help if I was awake.
There are two schools of thought about working on people that you know. One is you shouldn't do it, and one is maybe you're the best person to do it. In some ways, I feel like I'm kind of the best person to do it, because if it's something I do well, I only do things anymore that I love to do and that I think I do well. And so I don't think it would be right to send someone away just because I happen to be their friend or employer. So Joanie's an interesting person. She's been working with me for about 3 years now. When she came here, she really brought a new life to our operating program.
I've done hundreds of surgeries at this point in the 3 years, so I know what a great team we have, what a great process it is, and the service that is delivered is above and beyond.
To do a good job of this neck lift, a deep neck lift, really changing the foundation, takes about 3 hours. To put that in perspective, liposuction of the neck takes about 30 minutes. Patients that are a good candidate for this with good skin elasticity like Joanie has, good foundation shape like we're going to create, we can do that with one hidden incision. People can inspect their ears and see nothing because there is actually no incision around either ear. So when we're treating the neck, and if we're treating it well, we can treat more than just the skin and the fat on the outside. We can also treat the muscle behind that, and in this case, we can treat what's behind the muscle, the true foundation of the neck. The other thing Joanie has is she's always had chipmunk cheeks. She's always been a little bit full in the front part of the cheek, and that's something that we can take a little bit of fullness out through the inside of the mouth. And what that will do is offset her cheekbones. It'll show off pretty cheekbones. It'll taper her face as it comes down into her brand new sharp jawline. So we're going to be able to really reinvent the lower 2/3 of her face through one incision hitting the crease behind her chin.
I know my result's going to be amazing. That's why I'm doing this. Fear no mirror kind of thing, and fear no angle of like what picture I'm taking.
The incisionless neck lift is my favorite procedure to do for a full neck. And Joanie, being a good friend and employee, I was really happy to do that for her. It's been almost 3 months since we did it, and now I think you can see she's got a really pretty neckline. It's straight back. Her jawline shows up really well. By taking that buccal fat pad out, she's got a shape to her face with high cheekbones, then more of a sculpted lower face and neck.
I saw the immediate results on post-op day 1, so that was exciting to see, like, this is where I'm going to land, this is what it's going to look like. Then the swelling starts to happen, so it takes a little bit of time.
So with this kind of neck lift, there's a healing process. And so the first few months there's swelling, and most of that swelling is trapped right under the chin. Right now you don't see it as much, but there's still just a little bit of fullness, a little bit of swelling under the chin. So over the next 6 months or so, her result will actually get better.
The first few days were a little rough. rougher than I expected, but all very tolerable and manageable. After the swelling peaked, I feel like it was several weeks before I really started to see the shape come along.
Joanie was a perfect person for this particular procedure because she had an overall good jawline, so we didn't need to do any kind of lifting in the cheeks, so we could skip ear incisions. And she had fullness in the neck that we could sculpt and create a really nice shape out of.
I work with Dr. Nayak every day in surgery. Being a patient, I still feel like I was very informed. I knew everything to expect. It was a great experience, and I would do the surgery again tomorrow.
This is one of my favorite procedures to do, and I was really happy to do it for Joanie because it takes actually a younger person, changes something about them that they're often self-conscious of, and then their confidence and their self-image is better for the next 30 or 40 years. This is something they can enjoy for the long term.
Today with Facebook and Instagram, we're always sort of photoshopping and really scrutinizing our pictures, and I feel like now I can take a picture